Geographic tongue, which is also called as benign migratory glossitis. What is geographic tongue? It is an annular lesion affecting the dorsum and margin of the tongue. The lesion is also known as erythema migrans or benign migratory glossitis, as said as before. The typical clinical presentation comprises a white, yellow, or gray color, slightly elevated peripheral zone surrounding an erythematous patch. The occurrence of the geographic tongue makes people worried and prone to self-observation of the tongue. It creates a disproportionate level of stress. Additionally, it may cause symptoms while eating certain types of foods like hot, spicy foods. Sometimes people discover it during self-examination of the tongue if they have burning mouth syndrome. Etiology. Although geographic tongue is one of the most prevalent oral mucosal lesions, there are virtually no studies available with the objective of elucidating the etiology behind this disorder. Several factors have been proposed as possible causes, such as emotional stress, psychological factors, habits, allergies, diabetes, and hormonal disturbances. However, none of these factors have been conclusively linked to geographic tongue. Clinical findings. The main feature of the geographic tongue is the presence of uneven red patches on the top, sides, and underside of your tongue. These patches may have a white or light colored borders, may change in size, shape, and color. It may start in one area and then move to another. It may be smooth, unlike the small bumps like papilla that usually cover your tongue. Another feature of the geographic tongue that it may be followed by a fissured tongue, and sometimes these two lesions are observed simultaneously. The appearance of the tongue dorsum may vary greatly from a mild presentation to a very dramatic one. A geographic appearance can be observed at the sides of oral mucosa other than on the dorsum of the tongue and is then denoted geographic stomatitis. Sometimes it is also called as ectopic geographic tongue. In other factors, some people with geographic tongue might have a burning or painful feeling. This is often because of things such as hot, spicy, or acidic foods, cigarette smoking, and toothpaste. And the risk factors of geographic tongue are eczema, psoriasis, type 1 diabetes, certain types of arthritis, a family history of geographic tongue, and not having enough iron, zinc, folic acid, and vitamin B6 and B12. And it may also the risk factors having a fissured tongue and taking hormonal birth control pills and a lot of stress and allergies. The geographic tongue is mostly diagnosed by its characteristic clinical feature. If biopsy is considered, it should involve the peripheral zone to capture the lesions, which shows the typical histopathological features. The histopathological features include parakeratosis, acanthosis, subepithelial inflammation of T lymphocytes, and transepithelial migrating neutrophilic granulocytes. And then the treatment of geographic tongue. Since the etiology is unknown, there is no availability of casual treatment strategies for this lesion. Symptoms are rarely present, and the management is mainly confined to the reassurance of the patients and providing proper information about the disorder, which is only the benign character. And if they have any pain or discomfort, will probably get better on its own. If not, the medications prescribed are over the counter pain relievers, anti inflammatories, mouth rinses with anesthetic agents, and corticosteroids, which is applied on your tongue, and zinc supplements.